a urology department, we like to do a lot of research, we like to take part in whatever becomes available. We wanted to do something within urology with our follow-up patients, because we know that if you've got a stable disease of prostate cancer, then it can be monitored in the same way as any other chronic illness. The hospital is getting inundated with follow-ups. So these patients were coming back to clinic every 3 months, every 6 months, every 12 months. So it's quite a burden on the hospital to do with follow-ups, and a burden on the patient. Time off work, car parking, and the anxiety of getting that PSA done 2 weeks before being seen, and then to be told, actually, you're okay, we don't need to see you for 6 months.
The number of diagnoses is increasing due to improved diagnostic methods, and as well as due to improved treatments. We are having more and more patients surviving prostate cancer. There is not a big focus on prostate cancer survivorship, where you look at the holistic needs of these patients. The TrueNTH project was launched by Movember Foundation, and in UK it's being led by the Prostate Cancer UK. These patients, through the TrueNTH project, they will be trained and they'll be given the tools to self-manage.
We've got nearly 300 patients on the project, and the patients love it because they know they're part of a team and they're not just charged back to the GP out not knowing what to do. They learn because in the workshop we teach them about their disease, they take ownership of their disease.
The Prospect group is made up of a group of people who are the same as me, and the good part about it is the fact that when you go in there, somebody in there has got the same problems you have.
It's a good way of pointing out things and reminding you of what you should be doing, what you should be looking at. I'm so glad that they've introduced it at a time when I was just, as it were, just right for that part of the programme.
We cover topics like the PSA, signs and symptoms, diet and exercise.
In addition, they're also logged into an online PSA portal. So therefore, once they have the PSA blood test done, the results are directly forwarded to the online PSA portal, and then the patient can check the results in the comfort of their own home.
Depending on when the gentlemen have had their treatment on this project, as long as they're stable, up to the first year, their PSA might be tested every 3 months, and then after that be every 6 months. I'd prompt them when to have their blood test taken, then it's downloaded onto their IT portal system, so if there's any changes in their PSA, that can be flagged up, so we get involved to have a look at that.
It's reassuring. I appreciate that it's still got to be monitored, and I've got to be aware that's part of this self-management program, in that I keep myself in as good a condition as I can, and of course the program itself allows you to monitor that.
Even though it is remote monitoring, they're not remote enough to have forgotten about, and they are in contact. They can email me through the IT portal system or just pick up the phone and give me a call.
If there's a niggling problem, you can actually go and say, look Faye, I know it's off the cuff, but I've been having this feeling, or this has happened, what do you think? And she can reassure you, or she can say to you, don't worry, I'll have a word with Mr. Madan, I'll get you in to see him. And that's worth its weight in gold.